Articulation, so the upper limb. The upper limb consists of the pectoral girdle and the free part. These two parts join together by shoulder joint. Also, the pectoral girdle connected to the trunk only by one joint, sternoclavicular joint. Also, the upper limb has the example of syndesmosis as interosseous membrane between the radius and ulna. Examples of the several ligaments on the wrist and on the shoulder. Also, synchondrosis on the development stages in metaphyseal disc, which become one single bone. But for the difference, for the long tubal bone, the clavicle and metacarpal bone has only one metaphyseal disc, that these bones can grow during whole life. Sternoclavicular joint. The synovial sellar joint, only one articulation between the axial skeleton and appendicular skeleton in this region, and located between the clavicle and sternum in this region. This joint also has very strong capsule that attaches the anterior superior aspect of the sternum and clavicle with anterior aspect, and also fuse with the ligaments in one single band. Also, under the fibrous capsule you will see the two articular surfaces which cover it by the cartilage, and also you can see the articular disc inside the joint which divide this cavity on the two separate synovial cavities between the sternum and clavicular surfaces. Next joint of this region is acromioclavicular joint. Acromioclavicular joint is formed by the next joint of this region is acromioclavicular joint between the acromial process of the scapula and clavicle. This joint is simple. This joint is also combined with the previous sternoclavicular joint and flat type of joints. This joint also is optionally complex, which means some cases in some person it can be complex, but some person has no disc inside this joint, that this joint is not complex. The reason why this joint has a disc inside which separates another two cavities, it is hard physical work of the person. Okay, and ligaments which make the stronger these two joints. First ligament on the proximal end of the clavicle is claviculo-costal ligament between the first rib and the clavicle, and second it is between the clavicle and the coronoid process. It is trapezoid ligament and conoid ligament. Also on this region present some syndesmosis of the scapula, which is first superior transverse scapular ligament and inferior transverse scapular ligament. These two ligaments form the foramens through which the arteries will pass. Also, between these ligaments, in the sites of movements and close relationship between the bones, you can find the bursas, coracoclavicular bursa, which prevent trauma and erosion between these two bones. Next joint of this region is shoulder joint, or Latin name is Articulatio glenohumerale, which name the two articular surfaces in this name. First of all, it is glenoidal cavity of the scapula, of the head of the scapula, and head of the humerus. But this joint is not congruent, which means the head of the humerus is larger than glenoidal cavity, that it can be a reason of dislocation of this joint. That's to prevent it. In this joint exists some specific cartilaginous rim which surround the glenoidal cavity, and calls the labrum. Glenoidal labrum, as the name suggests, form a lip around the shallow glenoidal fossa or glenoidal cavity. The glenoidal labrum forms a rim around the glenoidal fossa, thus deepening the cavity, forming a socket for the head of the humerus. Therefore, it may assist in stabilizing the humeral head as it sits in the glenoidal fossa. Also, this joint has only one ligament between the coracoid process and humerus. This narrow ligament between the coracoid process and humerus. There's only one ligament which protects this joint. Coracohumeral ligament attached to the dorsolateral base of the coracoid process and extend laterally to the greater and lesser tubercles of the humerus and blends superiorly with the articulation capsule. Also, this joint has a lot of bursas. A lot of bursa will surround this joint. For example, the supraacromial, subdeltoidal, anterior coracobrachial bursa. This one is subtendinous bursa of subscapular muscle, etc. The bursas of the upper limb is sac-like structure with the inner synovial membrane that produce a thin film of synovial fluid. They are situated between the bony prominences and structures that may oppose them, such as tendons, ligaments. Also, this joint is ball and socket, which means this joint has a huge amplitude of movements with all possible axes: flexion, extension, rotation in all directions, like anterior, posterior direction. The elbow joint. Elbow joint or cubital joint, articulatio cubiti, is essentially a complex of three joints, including the humero-ulnar joint, humero-radial joint, and proximal radio-ulnar joint. The humero-ulnar joint and humero-radial joints form the complex hinge joints that allows flexion and extension of the forearm, while the humero-radial joint, along with the proximal radio-ulnar joint, facilitates pronation and supination of the forearm. The humero-ulnar joint is formed by the articulation of trochlea of the distal humerus with the large trochlear semilunar notch of the ulna. Its stability is reinforced by the medial and lateral collateral ligaments. Also, by anterior articular capsule in full extension. If we reduce this capsule, we'll see the main bones which form it. This joint has three main articular surfaces. First, capitulum of the humerus, trochlea of the humerus, semilunar fossa of the ulna, and articular surface of head of the radius. Also, between the radius and circumference of radius and radial notch of the ulna. These all joints works together. That's why this joint is compound, but each joint separately is simple. Together, all elbow joint is not complex because we have no any disc which separate it. Also, this joint is in generally combined, because all these joints move simultaneously and shape of this joint. If we talk about the elbow joint, together it is modified hinge joint, but humero-ulnar joint is trochlear, humero-radial joint is ball and socket, and the proximal radio-ulnar joint is cylindric, has also triceps subtendinous bursa and also olecranon subcutaneous bursa. The ligaments of this joint. There is collateral ligament, radial collateral or lateral collateral, and ulnar collateral, or call it as medial collateral. Also, the ligament which also located in this joint is annular ligament of the radius, which protected and fixed it inside the joint. Next, articulation in this region is interosseous membrane, which present between the radius and ulna and fill all space between these two bones. Also has several foramens to passing of some nerves and vessels. Also separate two compartments of forearm, anterior and posterior compartments. And next joint of this region is radiocarpal joint, which hide above all of this synovial sheath. This also synovial and retinaculums, and if we reduce all these retinaculums and all of this synovial sheath, you'll see all bones which located in this region one with each other. But if we talk about the radiocarpal joint, which are located in this region, between the radius, scaphoid bone, lunate bone, and triquetrum bone, also with the articular disc in this region. These all bones form the wrist joint or radiocarpal joint. The wrist joint formed for the proximal part of the hand and is composed of the complex of 8 carpal bones which articulate with the radius of the forearm proximally and the metacarpal bones of the head distally. The radiocarpal joint or wrist joint itself is condyloid or ellipsoid synovial joint formed by articulation of the proximal row of the carpal bones, such as scaphoidal, lunate, triquetrum, pisiform, etc. But I make a mistake, not without pisiform bone. Pisiform bone does not involve in this joint. Also, with the distal end of the radius and articulation disc, which located in this region. There is articulation disc of the radiocarpal joint. It is composed of the articular disc of the radioulnar joint, of the ulnar carpal meniscus, of the ulnar collateral, dorsal and palmar radioulnar, palmar ulnar carpal ligaments, and the floor of the tendinous sheath of extensors carpulnaris of the posterior region. The articular disc of the distal radioulnar joint, triangular in shape, where its base attached to the medial edge of the radius, and its apex extend across of the ulnar head and attached to the styloid process of the ulna. These attachments separate the distal radioulnar joints on the two portions, on the two cavities, form the radiocarpal joint. The main axis movements of this joint. Movements of the radiocarpal joints include the flexion, extension, and adduction of the hand, or successive combination of these movements which form or resulting in circumduction, means it increased volume of movements by the combination flexion and adduction to form some ball and socket-like movements in this joint. I saw that more details describe this all joints better will be in the class time. During the class time we will discuss about each of these joints together in the range of all of them. The bottom line of this all information. The articulations of the upper limb are very important in the human physical work, because all things what you do provided by your upper limbs. That's why on this region, on this part of our body, we have a lot of these synovial joints, which provide freely movements, sometimes simultaneously. And combination of these movements in the joints serve as good possibility to increase volume of movements to do better work. Also, maybe you paid attention on the absence or lack of synarthrosis on this region, because some of synarthrosis, such as syndesmosis, present only on the scapula and interosseous membrane on the forearm. Also, the synchondrosis present only in some developmental stages on the tubal bones, which help in growing of this, all help in development of these bones during life. Also can be used in the X-ray examination. X-ray examination. Thank you for watching.